Go ahead and pan around to my 7. I just got to show that there's 7 people here now. Okay. Alright, 7 adults. Alright. Recent headlines have brought current scientific research to the forefront that has expanded the health benefits of that vitamin D plays in the prevention of diabetes, hypertension, cardiovascular diseases, some illnesses and cancers, autoimmune diseases, and even obesity. Traditionally, vitamin D has only been seen to improve bone health, and the recommended daily allowance is based on that assumption. Therefore, people only consume the recommended daily allowance for vitamin D. Their bones should be fine, but they could be missing out on the full benefits that this nutrient can provide in losing weight and preventing an array of diseases and conditions. Scientific research is continuing on vitamin D's health and fat loss benefits, but in my extensive research on this subject, I have found this information compelling enough to share with each of you today. With the growing prevalence of obesity, diabetes, cardiovascular diseases, hypertension, autoimmune diseases, and cancers, prevention is a key to having a healthy life. Being informed on eating right, exercising, drinking enough water, and consuming an adequate amount of vitamins and minerals is important to keeping our bodies healthy and preventing disease and illness. Today I'm here to talk to you about vitamin D's health and fat loss benefits and look at how increasing our daily intake of vitamin D above the recommended daily allowance can help prevent many undesirable diseases, illnesses, and conditions. We will begin by looking at what vitamin D does for the body. Second, we will examine the link between vitamin D and obesity. Third, we will consider why the recommended daily intake for vitamin D isn't higher. And finally, we will look at how we can get enough vitamin D. And I will provide some wise food choices to consume that are packed with vitamin D. By the end of the speech, I hope to convince all of you of the importance vitamin D plays in our bodies and to persuade each of you to increase your daily vitamin intake. So to begin, vitamin D is a fat-soluble vitamin that essentially acts like a hormone in our bodies. It plays a role in improving bone health by promoting calcium absorption in the gut, helps maintain adequate levels of calcium and phosphate in our blood, and is necessary in bone growth and remodeling. Vitamin D is so important for bone health that without adequate levels of this vitamin, we could have thin, fragile, brittle, or misshapen bones. But the health benefit of vitamin D doesn't stop there. We actually have vitamin D receptors throughout our bodies, and vitamin D is also known to help in cell growth, neuromuscular and immune functioning, and reducing inflammation. Despite vitamin D's many health benefits, many Americans are falling short of adequate levels of this vital nutrient, due in large part to the rise in obesity. Obesity and vitamin D are inextricably linked to one another. The more body fat someone has, the more likely they are to have low levels of vitamin D circulating in their body, and less they have available for use in their bodies. Current scientific research has shown the link between obesity and low vitamin D levels may be more prevalent in Hispanics and African Americans than in Caucasians. Since obese adults have low levels of vitamin D in circulation, scientists have theorized that this fat-soluble vitamin gets stuck in fat tissue. Some studies have shown that this uptake of vitamin D into fat tissue is actually greater in obese individuals than in lean individuals. What's worse is inadequate levels of vitamin D is not easily corrected in the obese. Weight loss alone is not enough to counteract the decrease in vitamin D absorption, as is shown the case to be with individuals who have recently undergone bariatric surgery to combat obesity. Vitamin D deficiency is common after bariatric surgery and is difficult to combat. Though it seems that obesity leads to low levels of vitamin D levels, some have theorized that insufficient levels of vitamin D may contribute to obesity. According to a recent study published only 2 months ago in the Journal of Women's Health, low levels of vitamin D was found to be linked to weight gain in women older than 65. The study found that women older than 65 with insufficient levels of vitamin D in their blood gained 2 more pounds than their counterparts with adequate vitamin D levels. Though the study only found to be a difference of 2 pounds over time, that weight can easily add up. So if you're asking yourself, if vitamin D is so important, why isn't the daily intake recommended higher? It's because there have yet to be any large-scale, randomized, controlled clinical studies, the so-called gold standard of scientific research, to be completed as of yet. A study such as this would examine the role vitamin D has in the development or progression of any of these diseases and conditions. Until a study such as this can be completed, the recommended daily allowance for vitamin D intake will be based solely on bone counts. The good news, though, is that the National Institute of Health is currently sponsoring a study that would look at the effects vitamin D has on the risk of developing heart disease, cancer, and stroke in over 20,000 men and over 50 and women over 55 without any prior history of these diseases. Despite the emerging research on the health and fat loss benefits of vitamin D, many Americans are still continually falling short of this adequate levels of this vital nutrient. To combat these inadequate levels of vitamin D, it's important to consider increasing your consumption of food that are naturally packed with vitamin D, such as salmon, mackerel, tuna, and sardines. Other foods to consider that are fortified with vitamin D are milk, some brands of yogurt, breakfast cereals, sports nutrition bars, and protein bars. There is also the option of taking a vitamin D supplement. So, while it may be too soon to know completely if insufficient vitamin D levels may impair weight loss or increase one's risk of certain diseases or conditions, the research is there that it is vital to your vitamin D levels that they are above the normal limits. In conclusion, it's important to remember what you eat and that you are what you eat, and it's important if you want a strong, healthy body, to give it the proper nutrients is key to having a clean, healthy engine. I hope I've provided you with some insightful information on the importance of vitamin D. Thank you.
All right.
Good job. Thank you. You can get into that.
That's good.
Can I buy it by the gallon?